Hi, my name is Jen Berkman, and I'm the marketing manager with Medical Specialists of the Palm Beaches. We're here today with board-certified hematologist and oncologist, Dr. Paul Lin. In addition, he also has a PhD in molecular genetics. How are you today, Dr. Lin?
Hey, good. How are you, Jennifer?
I'm good.
Nice to be here.
Yes, this is a beautiful meeting.
Right.
So my first question for you is, if you could be anyone for a day, who would it be and why?
Well, that's an interesting question. My sort of model or, the person that I'm inspired to will be Francis Collins, who used to be the NIH director. And the other one will be Dr. Hongzhou, who is the person that discovered this immunotherapy that has a widespread utility nowadays. And for Dr. Collins, his major contribution to the field of cancer or even to medicine in general is to sequence the human genome. So he studied this human genomic project, whereas Dr. Hongzhou, he started this research work on immunology, and that basically has a fundamental breakthrough in understanding of how cancer cells evade the attack from the immune system. So that's via a particle called PD-L1 that sort of shut down the PD-1 on T cell molecule.
Wow. So basically, these two people, they're both scientists, they're both the pioneers, and they discovered these things about cancer. That's interesting.
Well, they basically are physician scientists like myself. And the only difference is that they pretty much do more research than seeing the patients, although maybe they keep some clinical hours in patients, but their primary effort was to do the research. For me, I sort of decided to do the opposite. I see more patients, obviously, but I did my research years, working on similar, molecular genetics projects, trying to understand what a mutation can do to the function of a protein. And number two, what kind of functional effects on a cellular level that mutation will confer. And thirdly is to use now a popular treatment approach called synthetic lethality. What that is that you know that the cells has sometimes two pathways. They interact with one another, and if one is impaired, the cell is still okay. But if you knock out the other one alone, same thing, the cell is functional. But if you knock out both at the same time, the cell just cannot survive. So we call it synthetic lethality. And now it started to have application in cancer therapy, particularly for breast cancer, ovarian cancer, or prostate or pancreatic cancer.
Okay.
So that's the famous mutations called BRCA mutations. So,
I see. Wow, that is a lot. That is so fascinating that there's been breakthroughs.
Right.
So my next question for you is, why did you decide to become a physician?
Well, I mean, so in the beginning, it was just simply going to undergrad, and then we see all those students with both MD, PhD, starting for both MD and PhD, and then the confidence in their face, and then the ambition and all that, and then and having at a time a family member got diagnosed with prostate cancer, and then so that's sort of what the first step toward this combined scientist and medicine career.
Wow! So that placed you on the path, and you kept going on the path, and you found it more and more interesting, and here you are today with your MD, PhD.
Right.
That's incredible. That's incredible. You're a healer, a lot of people have been saved by you. That's incredible.
Yeah, so, that's the goal. We'll keep pushing the envelope so that hopefully one day, the cancer will become chronic disease, like managing diabetes. Well, then, it's like when you get diagnosed, then, in the old days, pretty much is that it is it, So no, not that anymore. The treatment has been becoming much better tolerated, and the response is even better.
That's incredible.
So the leverage is getting much better.
Incredible. Yeah. Like I said, medicine is always going forward. Science is always going forward. So that's incredible.
Right.
So that leads to my next question. When it comes to hematology-oncology, what do you wish people knew about it?
Well, along the same line, it's just, don't be afraid of, cancer diagnosis. Obviously, the earlier the diagnosis, the better. That's still the same. But a lot of time, even patients who are diagnosed with metastatic disease, some of them now get to survive for years. And again, going back to my initial heroes that I admire the most, Dr. Francis Collins, who, because of his genomic projects, we know what the normal genes of our DNA is supposed to be and what's wrong with the cancer. The cancer basically is a genetic disease, meaning that it doesn't have to be hereditary, but most of the cancer the mutations are acquired. So when you have those acquired mutations, somehow they convert the cells to become cancerous. And there are so many different pathways they have to work together to make the cells cancerous. So that is sort of the fundamental breakthrough in the cancer therapy. You probably heard about the targeted therapy, knowing what is wrong with the cell, what kind of mutation this particular patient has, and sometimes those mutations are the driving mutation, meaning that you interfere with this defect and the cells will become will be under control. And sometimes the response can be dramatic, up to 80-90%, and patients feel much better within a short period of time with this targeted therapy. On the other hand, the immunotherapy is really astonishing, because now we see these long-term survivors, say in people with colon cancer who has this mismatch repair enzyme deficiencies. We have patients, failing chemo, the traditional chemo, one line after another. Then all of a sudden, year 2016, 14, 16, and every year there's a new indication on different cancer types. Then this drug, Keytruda came along, and she was put on it, and she went into remission. It has been several years. So we don't see that. In the past, we don't see things like that. After the chemo, if you failed the chemo regimens, pretty much, you have nothing else that you can do. But now with that particular mutation, the outcome is amazing.
That's amazing.
And same thing for lung cancer. I can go on, but it's quite astonishing.
That is quite incredible and astonishing, like you said. So what's one simple thing that people can do to maintain their health?
Well, I mean, we come a long way in medicine, so it's not just cancer. People, should do, their, exercise, cardiovascular, and then, infection. Don't take any risk-taking behaviors. Some of this viral infection like HIV, if you, take precaution, we don't have to be infected, right? So the infectious disease, cardiovascular, and, now as life expectancy sort of get longer and longer because we're better medicine. In old days, you get infected, you have no antibiotics, and a lot of people die young, And now you pass that initial phase and you get into the cardiovascular, territory. And then thanks to all these advances in the cardiovascular care, now, people go past the 50, 60, and then guess what? Cancer started to become prevalent because that's the elderly people's disease primary, and people now live long enough, and cancer incidence go up with the age group. So just don't do anything that can cause cancer, increase the risk of cancer, like smoking, certain viral infection, female. Do the pap smear, and some of them like age related. Each time the cell divides, there's a small chance of getting a mutation. So, the aging process actually is the biggest risk factors for getting cancer, because the cell, each time the cell divides, there's 1 out of a million chance of getting a mutation. And if that mutation causes cancer, then the cell will keep it. That cell is altered forever. And then it will pass on from 1 cell to 2, 2 to 4. And then if additional mutation is added to that original mutation to one of those cells, then you have a problem of a cell that harbors 2 mutations. The things keep on going till the point where you got 10 to 12 mutations. They estimated that is time when you have a full-blown cancer. It's like about 10 to 12 genes are messed up to give you a full-blown cancer.
But as you had said before, there is a greater chance of getting healed and having the right medications and the right immunotherapy.
Right. So to understand hematology-oncology, I would say for oncology per se, the survival of cancer has been getting better. And that is because of all these efforts that, we put in since the 70s. President Richard Nixon declared war against cancer. And then so first important thing is the prevention. You don't have to do any things that increase your risk of getting cancer. Don't do it. Smoking is a notable example. And then, some people started getting into this metabolism things, obesity and all that might start slightly increase in the risk of cancer. And then you talk about the treatment. The treatment is getting better. So the mortality rate goes down not only because of the early detection, the earlier the better survival, but not only that, but also the better treatments. So efforts have been put in improvements in the surgical techniques, which is one modality for early stage cancer. Radiation, they're getting more and more conformal, meaning that they just treat the area that's involved and then they try to spare the normal adjacent normal tissue by spreading a dose. So thanks to the computer advances in computer and in treatment planning, and the so-called therapeutic ratio is getting better and better, meaning that you have a higher radiation dose to the tumor with less radiation dose to the normal tissue. So radiation become better tolerated and even more efficacious. And then now they have even proton beam to treat certain type of cancer with very high precision radiation to the tumor with a very rapid force off of the radiation dose. So that is the radiation story. With respect to what I do, medical oncology, it's just basically everything goes. Chemo is still used, but we have better management, supportive care. So it's not as, people would think that, chemo, I'm going to be sick like a dog or this and that. Manage the supportive care is much better. We have a growth factor support so that the count will drop and delay the treatment. So that's important in keeping the chemo schedule. But not only that, we're getting smart. The smart bombs, the targeted therapy. If you have a particular mutation for lung cancer, there's 7, 8 of those specific mutations. And if you do have those, you don't need a chemo. What you need is a targeted therapy. And like I said, a response rate can be 80, 90%.
Perfect.
Right?
Wow.
So that's a targeted therapy. And again, going back to Francis Collins' initial efforts to try to sequence the whole human's genome so that we know what is supposed to be the right sequence in the DNA. And when cancer happens, we know what is the mutation. And if you identify those mutations, now we have drug for them if that mutation is responsible for the causation of this phenotype or the, why cancer cells are cancer cells. So that's a targeted therapy. And yet, saving the best for the last, I would say, is the immunotherapy. So in 2014, FDA approved the first immunotherapy, Keytruda, to treat melanoma. And what used to be, nothing you can do pretty much. There's a mutation, targeted therapy can be used in certain subset. But when in the old days we use some chemo pills or interferon or IL-2, those growth factor, really the outcome is really dismal. So then come with this breakthrough finding by Dr. Hojo from Japan, who subsequently received Nobel Prize in 2018, together with Dr. Allison, who also discovered another molecule for immunotherapy, the CTLA. So what they are is pretty much the molecule that is on the T cells, and the cancer cells somehow has ability to silence them via some cell-to-cell interaction with some protein. So they figured out that in the old days, why immunotherapy failed. We know that immune system is important in the treatment, in the fight against the cancer at the cellular level. But why our body's immune system is not functioning as if they don't see the cancer cells. So the old approach was that maybe they are not working hard enough. So in the old days, 30 years of some famous scientists at the NIH, they just keep trying to push harder and harder, hit on the gas pedal and thinking that because they are not going fast or hard enough. Turned out that was not the case. The cancer cells, actually, the immune system is ready, but they are silenced by the cancer cells. So hence come this PD-L1 molecule discovered by those two Nobel Prize winners, right? And so that is really cancer cells putting a brake on our immune system. And then so if you give this treatment, Keytruda or alike, you actually can unleash the brake. So that once you give the drug, the immune system is all charged up. But all of a sudden, they are not silenced anymore by the tumor cells, and they are there just to attack.
Okay.
And again, every day we see these long-term survivors, be it rectal, colorectal.
And since we're talking about long-term survivors, tell us one story about one of your favorite stories about your patients.
Well, obviously, we got this surgeon's wife, who I co-managed with a major cancer center up north. And then so she came down here for the winter time and went through a couple of chemo lines for metastatic colon cancer, and some response in the beginning, but eventually they progress, and which is a natural history of that. But then with approval of that drug Keytruda, immunotherapy, and the reason we use that is because she was lucky she had this mismatch repair enzyme deficiency, and then so people with colorectal cancer with this particular enzyme DNA mutation or mistakes, they tend to respond to immunotherapy very, very well. And
so she responded very well to the
immunotherapy. Oh boy, she went into complete remission.
Wow, that's incredible. Right, that must have made you feel so good.
Oh yeah,
wow.
that feeling is that feeling is beyond words, right?
That's incredible.
And then it's not only just that short-term remission; it has been several years, and then she just saw her the other day, we reviewed the CT PET scan. She's basically in remission. So
that's great.
I mean, that is, an awesome feeling. And it's not just that. We see head and neck cancer patients went through chemo radiation surgery, and it was just nothing you can do. Again, given the immunotherapy, this thing is basically, we still see the scar tissue, but basically there's no disease on the PET scan. It's remission for years.
Oh, wow.
So, the story goes on and on. PD-L1, if you have this, protein that's greater than 50%, I have quite a few patients, lung cancer patients, metastatic disease, in the old days, would have been 9 months, 10 months with chemo. Now they're going into their several years, and then they have a complete response to immunotherapy. So all this success story is becoming the norm in the daily practice. So I would say thanks to science is leading medicine, and I think that with ongoing efforts in this field will be pushed even further and further.
That's incredible. Thank you so much, Dr. Lin.
Yep.
We just loved having you here today.
Right.
Thank you so much.
It's my pleasure.
Thank you so much for watching us today. And please like us and follow us on YouTube, Facebook, and Instagram. MSPBHealth.com. See you soon.
Bye-bye.